Now we are going all the way to Indonesia. My pleasure to present Dr. Antonia Morita. Dr. Morita is based at the Faculty of Medicine, Public Health, and Nursing University Gajah in Indonesia. She obtained her PhD from the University of Groningen and has worked in developing diagnosis and treatments for tuberculosis. Her passion is infectious disease, immunology, and pulmonary disease research. She serves as a national delegate in the European Respiratory Society, vice coordinator of Frontiers of Science in the Young Academy of Indonesia, editorial board member in the BMC Infectious Disease, and is active in the Unite for TB, Global Young Academy, and other international organizations. She led a World Health Organization project aiming at developing TB e-learning materials for health workers and TB programs managers in Indonesia. Now in Indonesia, I think it's 2 a.m. in the morning, and we met at Lindau. And thank you so much for your participation.
Thank you so much, Gustavo, for very kindly introducing me. I'm just checking, could you hear my voice?
Yes, you can hear you.
Okay, great. So I will share the screen. Thank you so much for having and inviting me to this distinguished event. I really regret that I cannot attend it in person and that I cannot visit the beautiful Brazil and Rio de Janeiro. But I hope for now, this presentation can connect us and that in the future I could visit Brazil. So like what Gustavo already introduced, we are working in the respiratory disease and especially to detect tuberculosis through the artificial intelligence device. So have any of you experienced a bad breath or body odor? Probably some of you have, and me too. I have experienced it myself. However, did you know that bad breath or body odor doesn't always mean that we forget to brush our teeth or to use deodorant? In fact, it can be a sign of a disease such as cancer, infectious disease, or diabetes mellitus. And the art of smell to diagnose disease have already been found since the era of Hippocrates, our father of modern medicine. He and other physicians recognized that a certain smell could indicate a certain disease, such as strong and musty smell indicates liver disease, or sweet urine smell indicates diabetes mellitus. So what kind of compounds actually that can be detected in our breath to indicate the presence of disease? They are called as volatile organic compounds, small chemical molecules that are produced by our metabolism or by the microbes in our bodies. The combination of these VOCs is specific for every disease, and thus by recognizing this combination, we could differentiate whether the breath comes from someone who is sick or healthy. However, the combination is very complex, and that's why we need the help of AI to understand the pattern of the disease. So for example, here, this is the VOCs analysis from the COVID-19 patients. There are several increase and decrease in the VOC compared to healthy people or to people who do not suffer from COVID-19. Here is the increase of ethyl butanoate, the decreasing of acetone or propanol. However, there are also other pattern of increase and decrease of other VOCs. And the differences between people are also variable. That's why a reading system is necessary to recognize the pattern of the increase and decreasing of these VOCs. And here comes the role of the AI algorithm. So in Indonesia, our team developed the electronic nose, the device, to be able to detect disease from the breath. And to use this electronic nose, someone needs to collect the bread into a disposable collecting bag that will be connected to the device and then to the laptop. I would like to show you the video how this device works. I will share you to the other video. Oops. Yes, I hope it's already seeable now.
Yes.
Okay. Okay, that's the short video to let you know how the NOS works. I don't know whether you could hear the sound or not, but at least you could see the video, the movement. Okay, so I'll continue. So how does actually this electronic nose works? It works like our nose, and it derives the names from the nose. So the sensor, the chemical sensor in the electronic nose will catch the odor and then change it into signal that will be processed by the pattern recognition system that is analog to our brain. This is the EI here, the pattern recognition system, and it's similar to our brain. And to be able to recognize a disease, the nose needs to be trained, just like our nose that needs to be trained to recognize a smell. For example, smell of a coffee, whether it comes from the famous Brazilian coffee or whether it comes from the kopi luwak Indonesia. Our nose needs to be trained. The same here, electronic nose also, first, it needs to be trained to several breath patterns from sick people or from healthy and from other people who has different disease. After it will be trained, then it could recognize the next breath that is after the AI is really already formed, then it could diagnose a disease from the breath. So it's the scheme of the nose inside, like what was already in the picture, that a person needs to collect the bread into air collecting bag. This is disposable, connected to the device that contains of three-way valve, sensor array, and then it will be connected to the laptop. And here is the AI that analog to our brain, and there will be some algorithm that will be used to analyze the data. So why we use it to investigate the electronic nose for TB? Because the TB is one of the deadliest infections in the world, and the TB prevalence is very high. Every 1 minute, 12 people died because of TB. India has the highest prevalence, and then Indonesia, and also it still become a problem in Brazil. Also, the gap between the diagnosis, the estimated cases, and the people who are actually detected is very high. And the screening device now that is recommended by WHO has some limitation, which from symptoms, the screen sensitivity is quite low. The moderate, the X-ray has side effects such as radiation. Also, in the primary health centers and in the remote area, there is no facilities for X-ray. The WHO issued the end-TB strategy to end the TB epidemic in 2035, and by innovation of new tools, it can accelerate the elimination by further 17%. However, this gap is met before the COVID-19, and because of the COVID-19, the TB incidence is increased, including the Brazil, and that's why the innovation is more needed. So we developed the since 2018 by the prototype, and we do the training study for the TB patient 2019, but then the COVID-19 came 2020, so we expand the study to detect COVID-19. We produced the device massively and then distributed around Indonesia across the island. We have 17,000 islands, and we distributed around 4,820 devices. And now we are still continuing the study to finish this to investigate it for TB, finishing what we did in 2019. So it's already patented, getting the patent, the device, and we are collaborated with many institutions and also stakeholders. We train the students. They are involved in the data collection. We also taught them how the AI is working. We also collaborated with the industry who produce the sensor and also hardware of the device. In the training phase, when we train the device to recognize people who are sick and who are not sick, we got high sensitivity either for TB or COVID-19. And this is the DNN, deep neural network, is the best algorithm that we can use to detect the disease. However, when we applied for the validation study, when we distributed the devices around Indonesia, we got various sensitivity and specificity. And it's because of the difference in the mutation of the virus in the case of COVID-19, also differences among determinant factors like race, food, genetic, environment, cytokine profiles, clinical appearance, and also probably the differences in the quality of the sensor and the device production. And that's why we learned from our study that the breath analysis has the potential to be a future screening method for infectious disease. However, because the pattern of the breath is very complex, we need the help of the AI here. And like the concept of AI in general, we need to accumulate more data to make the AI smarter. And by accumulating also data that influence the sensitivity and specificity of the AI, such as race, food, genetic, and environment, it can be the correction factor for the AI, so it can improve the diagnostic accuracy of the AI. Like our laptop that needs to be always updated, the AI also needs to be updated, transitioning from static learning to reinforcement learning. And our goal is to produce a device that can be used in the remote area that is accurate, user-friendly, and portable, so it can help the people in the remote area to be diagnosed for infectious disease. I would like to acknowledge some people who help in the implementation of the study. And I would like to close this presentation from a quote from Louis Pasteur that is still relevant for our world today. Ladies and gentlemen, if we do not diagnose the disease correctly and treat the patients effectively, it is the microbes who will have the last word. Muito obrigado.
Thank you very much, Professor Antonia Morita. Thank you. Please, Mr. President.